Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. You may have seen my most recent blog post about what every new hygienist needs to know. And I'm quite passionate about this topic because I do still work in a dental office, and I see new temps, new hygienists who are fresh out of school all the time. And it's so true because it depends on who you talk to and your first office you start to work in. That all depends on how your experience is going to go, because I have heard all kinds of horror stories where I know somebody who actually became a hygienist out of high school. So she was one of the lucky ones where she was accepted age 19. She became a hygienist. This was probably about 10 years ago now. And she worked in an office where the dentist was horrible. He would get upset and literally throw instruments at her. He would be rude to her in front of patients and, so on and so forth. And now she's working at a Toyota plant, which isn't a bad thing, but to go from hygiene to Toyota is quite different, right? So here she spends all of this money taking the dental hygiene program. She spent all of that money to take the test. She passed it, but then she worked for less than a year because she just simply couldn't handle it. She said, you know what, life is too hard as it is, and to work for somebody who's horrible like that just isn't worth it. She tried to find a job. I'm sorry, you guys might hear my dogs barking again. She tried to find a job in other offices, but they weren't hiring at the time. Granted, she probably didn't try too hard because she, I think, had less than a year experience. She did try to look for something else, but then just thought, well, you know what? Oh, sorry guys, there you guys, sorry, I just had to stop the video for a second because my dog was going crazy. There was somebody at the door, but now no longer. So anyway, so here she is now working in a Toyota plant because she obviously needed the money, but she couldn't stay where she was. So she unfortunately had a bad experience. But I want all of you to have a good experience because I have been working in the dental field now for 12 years and I love it. Again, it depends on who you talk to, because some people will say to you, oh, well, hygiene isn't what it used to be. This isn't something you want to get into. You don't get paid nearly as much. It is hard work. You work so hard, and your boss typically doesn't care. You will hear all kinds of things. But if you think about it, that stems from not working in the right office in the first place. And now my other dog, Lily, is playing with her toy, so I'm sorry. This is real life, okay, guys? This is real life. But anyway, where was I? So it does depend on what office you are in the first place. Now, I was lucky because I became a dental assistant first, and I worked for an amazing office. In fact, I'm still at that office now doing hygiene and restorative hygiene too. So I've been there for 12 years and I love it because I think I was just lucky to find an amazing office off the bat. Things aren't easy as a new hygienist because you don't know what you're getting yourself into. You've learned everything in school. You've been in clinic, but you don't know how the real world works. You don't know how many patients you'll be seeing. You're probably thinking, okay, I had 3 hours to do a patient. Now I have like 40 minutes. How is this possible? So you will learn all kinds of things, but keep in mind that I am here to help because I know what it's like. Even if you've been working for, let's say, 5 years or 6 years or a couple years in the same office, if you go to work in another office, it's kind of like you're learning new things over again, especially if your other office was very old school, old fashioned, and then you go to work in another office where they don't have paper charts, it's all paperless. Maybe you are used to using the phosphoric plate X-ray system, but this new office has the sensors, new computer systems, new staff, new patients. All of this stuff is new. So if you haven't seen it yet, I do have, I believe it's a second edition, the full dental hygiene manual. So what I have in there is everything you have to know. It's perfect for new dental hygienists who are just starting out, because you learn all kinds of things in school, but then you have to apply it to your practice, right? So you may be thinking, okay, I know perio, I know what that is, but how do I actually apply that to patients? You know, how do I know when I have to refer them? How do I know how often to do the probing? How do I know how to write up the chart properly without writing too much, but you have to write a certain amount. So if you write too little, that's not a good thing either. You may be thinking, well, I kind of need to touch base how to take the x-rays, the certain angles. All of that is inside the full resource manual, and it is the second edition. So there's about 104 pages of all kinds of things that you have to know. So it's perfect. I know a few students have even printed it out also. It is 104 pages, but it's excellent. So that will sort of help you become comfortable, and it will help you to know which questions to ask also, because if you're new to an office, you have a ton of questions, but you may not know which ones to ask, right? Sorry, I was just looking at my puppy. She's eating something on the counter. Lily, what are you doing? Lily, stop. There we go. Sorry, guys. Where was I again? Oh my gosh. So, yeah, so basically what I want a new hygienist to know is that don't listen to everybody else, okay? Formulate your own opinion. If you are excited, keep that excitement. Don't let other people tell you like, oh, it's not that exciting. There, guys, sorry, I had to stop the video again because my puppy had something in her mouth that she shouldn't have had. Now, I think I've done this video like 5 times, so I'm sorry for pausing it, but the puppies are being silly today. So this will probably be the last video that I'll be doing today. I'll continue on with them tomorrow. It's kind of like having kids, like you just can't take your eyes off them for a second. But I was on something important. Okay, what was I talking about? Okay. So I was talking about don't listen to what everybody else says to you, because depending on the hygienist you talk to, some of those older hygienists, and this happened to me. This happened to me when I first started. You know, I heard things from the older dental hygienists that would pretty much say like, oh yeah, you're happy now. You're excited now, but give it another year or 2 and you won't be too happy. Like you'll be tired, you'll be exhausted, you'll hate everything because you will soon realize it's not about the patients, it's about making money and, you know, things like that. And I thought, oh, wow, okay. And then fast forward a couple of years later, these same hygienists were still saying that. And, you know, I started to get fed up a little bit, and I kind of said like, well, I've been here now for 5 years. I still love it. Could it be because I have a positive attitude and you don't? You know, like, come on. I mean, I didn't say that, those exact words, but it was annoying to have to work with certain hygienists who just were so negative. And those negative people bring the whole office down. So you need to think that you have to be that positive person who just loves it. I'm not saying that every single day will be amazing, like candy, rainbows. No, things are tough, but you are a dental hygienist. You are here for the patients. You are here to make those nervous, anxious patients happy and not nervous and not anxious. You are here to make those uber sensitive patients, you know, they're sensitive to hot, cold, sweet, sweets, pressure, everything. You are here to tell them that's okay. You know, we will help you. It may mean that they have to switch to a different toothpaste. You may have to do their cleanings over several appointments, whatever, but you are here to talk to them. You are here to make the patients comfortable, make the patients happy to see you. Because if you go through every day like, oh, I hate being a dental hygienist, this sucks, this is hard work, I don't get paid enough, that's not healthy for you either. That's not healthy for you. That's not healthy for the patients. That's not healthy for everybody. So think positive and be excited about being a dental hygienist who makes good money. You know, be excited, change your attitude, and don't let other people tell you that this is a crappy profession, this is no fun, this is too much hard work, you know, blah, blah, blah. Don't listen to other people, okay? Become excited, become passionate, and if you still try that, but for some reason just something isn't working for you, then you need to move to another office. Plain and simple. It could be because the staff don't get along or the whole office is too stressed out. It could be your boss isn't that nice. You might not be allowed to call in sick or take holidays, take vacations if you're not being paid for if a patient doesn't show up or if a patient cancels. You know, these things aren't normal. They're not normal. Easy for me to say because I'm not you, but, you know, try to make it so you can work at another office. You know, look for another job while you're still working so you obviously don't lose any money, but look somewhere else because this profession is amazing. And I would like to see more happy, more positive, more motivated dental hygienists out there because they're hard to find, you guys. So please just think happy thoughts. Don't listen to other people. If you need anything, please let me know. And keep in mind that I do have that dental hygiene full resource manual for you if you'd like, because that has everything, especially for a new dental hygienist who has questions and just isn't sure how to ask them. So stay tuned for the next video, and I apologize about this one. I had to stop it a couple times because the puppies were going crazy, so I apologize, but thank you for listening and stay tuned for the next video.